Hello everyone, I am Dr. Amit Gawande. I'm a consultant interventional pulmonologist and a critical care specialist in Mumbai and Andheri's area. Today we are going to talk about COPD and its effects and what causes COPD. There is a wide contention that smoking causes lung cancer, which is true. But the amount of or the percentage of patients who get cancer because of smoking is far, far less as compared to the patients who develop COPD. Now, COPD is what we call as a smoker's disease. It is a more grave and a more serious condition as compared to other conditions that we have. The reason being that the moment you see a patient or a man in public who's having a nasal oxygen or having an oxygen cylinder with him, most likely this is a patient of COPD. So COPD is something you should be more scared about as compared to lung cancer in a patient or if you're a smoker. The reason why we have COPD to be the most important diagnosis of this, even this decade, in India specifically, is because India contributes to more than 50% of COPD patients all around the world. So that's why India is one of the biggest COPD diagnosis patients in the world. Very important to know that smoking is one of the prime examples or prime causes of COPD. But in today's time, we have also realized that biomass gas, pollution, other kind of smokes that happen in our country, for example, are also a very, very big cause of COPD. So we need to safeguard ourselves as much as we can if we are living in a polluted city in the country. And secondly, if we are exposed to biogas fuels, like if you have wood burning gas in your house, if you are living in a village or a small town, very, very important to know that these in the future can cause COPD, and you might end up becoming very breathless and end up in an oxygen cylinder. So to prevent that, please make sure that you safeguard your lungs with masks, with good immune systems, and good diet and nutrition. Thank you.